Good day, my name is John Murty Grande from 2BSN1. I'm here to perform another class on breast milk expression, proper care and storage of breast milk, and alternative way of feeding the newborn. So first, breast milk helps keep your baby healthy. It protects against allergies, sickness, and obesity. It protects against diseases like diabetes and cancer. It protects against infection like ear infection, it easily digested, no constipation, diarrhea, or upset stomach. Breastfeed babies score higher on IQ tests. Good day mga mami, I'm Janelle Murty Grande. I'm here to teaching you the breast milk expression and proper storage, proper care, and alternative way of feeding of a newborn. Expressing milk is useful to relieve engorgement, relieve black, dark, or milk stasis. Feed a baby while he learns to suckle from an inverted nipple. Feed a baby who has difficulty in coordinating suckling. Feed a baby who refuses while he learns to enjoy breastfeeding. Feed a low birth weight baby who cannot breastfeed. Feed a sick baby who cannot suckle enough. Keep up the supply of breast milk when a mother or baby is in leave breast milk, a baby when his mother goes out or going to work. Prevent leaking when a mother is away from her baby. Help a baby to attach to a full breast. Express breast milk directly into the baby's mouth. Prevent the nipple and areola from becoming dry and sore. It is a good idea for all mothers to learn how to express their breast milk so that they know what to do if the need arises. The most useful way for a mother to express milk is by hand. It needs to appliance so she can do it anywhere and at any time. With a good technique, it can be very efficient. It's easy to hand express when the breasts are soft. It is more difficult when the breasts are engorged or tender. So, teach a mother how to hand express on the first or second day after delivery. Many mothers are able to express plenty of breast milk using rather strange techniques. If a mother technique works for her, let her do it that way. But if a mother is having difficulty expressing enough milk, teach her more effective techniques. So I'm here to teach that to the mother. So, the first question of the mother, how to express breast milk by hand. So, I will teach a mother to do this herself, to do not express her milk for her. Touch her only to show her what to do. Be gentle. I will going to teach her to, first you have to wash your hands truly, or sit or stand comfortably, and hold the container near her breast. So put her thumb on her breast above the nipple and areola, and her first finger on the breast below the nipple and areola. Opposite the thumbs, she supports the breast with her other finger. Press her thumb and first finger slightly inwards towards the chest wall. So she can should avoid pressing too far because that can block the milk ducts. Press her breast behind the nipple and areola between her finger and thumb. She must press on the lactiferiosis sinuses, then pit the areola. Sometimes in the lacting breast, it is possible to feel the sinuses. They are like pods or peanuts. If she can feel them, she can press on them or press and release. Press and release. This should not hurt. If it's hurt, the technique is wrong. At first, no milk may come, but after pressing a few times, milk starts to drip out. It may flow in trims if the oxytocin reflex is active. Press the areola in the same way from the sides to make sure that milk is expressed from all segments of the breast. Avoid rubbing or sliding her fingers along the skin. The movement of the fingers should be more like rolling. Avoid squeezing the nipple itself. Pressing or pulling the nipple cannot express the milk. It is the same as the baby sucking only the nipple. Express on breast for at least 3 to 5 minutes until the flow slows. Then express the other side and then repeat both sides. She can use either hand for either breast and change when they tired. That to express breast milk adequately takes 20 to 30 minutes, especially in the first few days when only a little milk may be produced. It is important not to try express it a certain time. To express the breast milk, place the finger and thumb each side of the areola and press inwards towards the chest wall. Press behind the nipple and areola between your finger and thumb, and press from the side to empty all segments. Next question, how often a mother should express milk to establish lactation to feed a low birth weight or LBW or sick newborn? She should start to express milk on the first day within 6 hours of delivery if possible. She may only express a few drops of colostrum at first, but it helps breast milk production to begin. In the same way that a baby suckling soon after delivery helps breast milk production to begin. She should express as much as she can as often as her baby would breastfeed. This should be at least every 3 hours, including during the night. If she express only a few times or if there are long intervals between expression, she may not be able to produce enough milk. To keep up her milk supply to feed a sick baby, you should express as much as she can as often as her baby would feed at least every 3 hours. To build up her milk supply, if it seems to be decreasing after a few weeks, express vary for a few days every 1 hour and at least every 3 hours during the night. To leave milk for a baby while she is out at work, express as much as possible before she goes to work. To leave for the baby, it also very important to express while at work to help keep up the supply, or like a woman and work to relieve symptoms such as engorgement or leaking at work. So express only as much as is necessary to keep nipple skin healthy. Express a small drop to rub on her nipple after bath or shower. Rubber valve pump are not very efficient, especially when the breasts are soaked. They are not suitable for collecting milk to feed a baby. They are difficult to clean properly. Milk may collect in the rubber bulb and it's difficult to clean out. The milk which collect is often contaminated. They are useful mainly to relieve engorgement. When hand expression is difficult, they are often called breast relievers. The next one is syringe pump. Syringe pumps are more efficient than the rubber bulb pumps. They are easy to clean and sterilize. How to use a syringe pump? Put the plunger inside the outer cylinder. Make sure that the rubber seal is good flexible condition. Put the funnel over the nipple. Make sure that it touches skin all around to make an airtight seal. Pull the outer cylinder down. The nipple is sucked into the funnel. Release the outer cylinder and then pull down again. After a minute or two, milk starts to flow and collects in the outer cylinder. When milk stops flowing, break the seal, pour out the milk, and then repeat the procedure. One is the warm bottle method for the expressions of breast milk. This is a useful technique to relieve severe engorgement when the breast is very tender and the nipple is tight so that the hand expression is difficult. You need suitable bottle made of glass and plastics, 3 liters in size, not smaller than 700 ml, with a wide neck at least 2 centimeter diameter, possible 4 centimeters, so the nipple can fit easily. You also need a pan of hot water to warm the bottle, some cold water to cool the neck of the bottle, and thick glue to hold the hot bottle. Pour a liter of the hot water in the bottle to start warming it up, then almost fill the bottle with the hot water. Do not fill it right up until too quickly the glass will crack. Let the bottle stand for a few minutes to warm the glass, wrap the bottle in the cloth, and pour the hot water back into the pan. Please cool the neck of the bottle with the cold water, inside and outside. If you do not cool the neck of the bottle, you may burn the nipple skin. So, put the neck of the bottle over the nipple, touching the skin all around to make an airtight seal. Use the soft part of your hand or forearm. Hold the bottle steady. After a few minutes, the bottle cools. Makes gentle suctions with push the nipple into the neck of the bottle. Sometimes when a woman first feels the suction, she is surprised and pulls away. You may have to start again. The warm helps the oxytocin reflex milk start to flow and collects in the bottle. Keep the bottle there as long as the milk flows. Pour out the breast milk and repeat if necessary, or do the same for the other breast. After some time, acute pain in the breast become less, and hand expression or suckling may become possible. The warm bottle method, like put the hot water in the bottle, pour out the water, the mother holds the warm bottle over her nipple. So how to help a mother whose baby is not getting enough milk? Like, take a history, breastfeeding factors, contraceptive pill, diuretics, assess like a breastfeed baby's position at breast, banding or rejection, examine like the baby illnesses or abnormality growth, examine the mother, her nutrition and health and her breast, any breast problem, build confidence and give support. Help the mother to give her baby more breast milk, like help to believe that she can produce enough, accept her ideas about breast milk, supply her feelings about breastfeeding, and her baby praises still breastfeeding as appropriate. Like, her breasts are good for making milk, give like practical health improvements, baby's attachments to breast, give relevant like baby sucking control, milk supply information. Like, how baby can more breast milk. So, simplify like breast will make more milk if babies take more. Like, more often longer at night. Stop using bottles or pacifier. Reduce or stop other feeds and drinks. Like, even if baby age less than 4 to 6 months. Like, ideas to reduce stress, anxiety, over to milk, to talk to family, help to lessen common causes. Like, to the baby condition if ill or abnormal treat or refer mother condition if taking exogenous pills or diuretic help her to change health as appropriate with other conditions. Like, follow up, see daily then weekly until baby gaining weight. Mother confident it may 3 to 7 days for the baby to gain weight. So, proper storage. Freshly expressed or pumped milk can be stored at room temperature 77 degree Fahrenheit or colder for up to 4 hours in the refrigerator for up to 4 days. In the freezer for about 6 months is the best, up to 12 months is acceptable. In the safe storage of expressed breast milk. Before expressing or handling breast milk, wash your hand with soap and water. If soap and water are not available, use an alcohol-based hand sanitizer that contains at least 60% alcohol. Mothers can express breast milk by hand or with manual or electric pump. If using a pump, inspect the pump kit and tubing to make sure it is clean. Discard and replace moldy tubing immediately. If using a shared pump, clean pump test, power sweep, and countertop with a disinfectant wipe. Storing breast milk after expressing. Use breast milk storage bag or clean, food-grade containers to store expressed breast milk. Make sure the containers are made of glass or plastic and have a tight fitting lids. Avoid bottles with a recycled symbol number 7, which indicates that container may be made of BPA or containing plastic. Never store breast milk in disposable bottle liners or plastic bags that are not intended for storing breast milk. Freshly expressed or pumped milk can be stored, like what I said, at room of 77 degree Fahrenheit or colder for up to 4 hours. And refrigerator for 4 days. In the freezer, it's about 6 months. The best up to 12 months is acceptable. Although freezing keep food safe almost indefinitely, recommended storage times are important to follow for best quality. So, what are the storage tip? Clearly label the breast milk with the date it was expressed. Do not store breast milk in the door of the refrigerator or freezer. This will help protect the breast milk from temperature changes from the door opening and closing. If you don't think you will use freshly expressed breast milk within 4 days, freeze it right away. This will help to protect the quality of the breast milk when freezing breast milk. Store small amounts to avoid wasting milk that might not be finished. Stored into 4 ounces of the amount over the one feeding. Leave about 1 inch of space at the top of the container because breast milk expands as it freezes. If you deliver breast milk to a child care provider, clearly label the container with the child's name. Talk to your children care provider about any other requirements for labeling and storing breast milk. Breast like stored in insulated cooler with frozen ice pack for about 24 hours. When you are traveling at your destination, use the milk right away, store in the refrigerator or freeze it. The safe thawing of breast milk. So always thaw the oldest breast milk first. Remember, first in, first out. Over time, the quality of the breast milk can decrease. There are several ways to thaw your breast milk. In the refrigerator overnight, set it in container of warm or lukewarm water under lukewarm running water. Never thaw or heat breast milk in microwave. Microwaving can destroy nutrients in breast milk and create hot spot which can burn baby's mouth. If you are thaw breast milk in the refrigerator, use it with 24 hours. Start counting the 24 hours when the breast milk is completely thawed, not from the time when you took it out of the freezer. Once breast milk brought to the room temperature or warm, use it within 2 hours. Never refreeze breast milk after it was thawed. Are the alternative way of feeding the newborn. So like cupping feeding, spoon feeding, syringe feeding, lactation aids, finger feeding, and bottle feeding are alternative feeding methods that allow oral supplementation of the baby was unable to obtain a sufficient amount of the breast milk from the breast. For most babies, these are temporary measures and the ultimate goal is to establish feeding at the breast. So, cup feeding. So, cup feeding is most successful when it follows the principle of baby-led practice. And the baby is able to control the pace and the amount of milk flow. So, the baby sip or laps the milk from the cup. Like cup feeding is the preferred choice as an alternative oral feeding method. Cup feeding encourages the baby tongue to move downward and forward to sip or lap. like a kitten up. That's supplement from a small cup. Cup feeding should be used on a short-term basis and be evaluated frequently. Cup feeding can be a relatively easy process. However, some mother may find it challenging to handle the equipment. Support from a family that like to help to help the mother. There may be some spillage and it can be messy. The equipment easier to clean the bottle or tubes. So the baby may only take 5 to 10 ml of supplemental first. How the amount of supplement take will depend many factors that baby satiation, the reason for cup feeding age, status of the baby, hold the baby it his mouth until there is enough volume for bolus to trigger swallowing. The baby always leads and controls the baby. And is spoon feeding. Like offering a small amount of the supplement on a spoon can be calm and infuse a baby or awaken a drone's baby. It can be used when a small cup is not available. A spoon is an easy and accessible way to offer a small volume of milk to baby, such as the early breast milk or colostrum. Spoon feeding is most successful when it follows the principle of baby-led practice. The baby is able to control the pace of the milk flow. And the baby may only take 5 to 10 ml of the supplement at first. However, the amount of supplement taken will depend on many factors, like the baby's satiation, reason for spoon feeding at each of the baby. And the baby always leads and controls the pace. One is syringe or syringe feeding. Like syringe feeding is somewhat similar to cup feeding. An eyedropper can also be used. Like syringe or an eyedropper feeding is most successfully when it follows the principle of baby-led practices and the baby is able to control the pace of the milk flow. And it's only take 5 to 10 ml the supplement at the first. However, the amount supplement take will depend on many factors. Like the baby always led and controls the pace. And the equipment in the syringe fitting, cloth to be placed under the baby's chin, supplement fluid or EBM or ABM if breast milk is unavailable or not appropriate. And the next one is lactation aid at the breast. There are 3 types of lactation aids, like lactation aids using a bottle, lactation aids using a syringe, commercial lactation aid. A lactation aid at the breast may be the method of choice to supplement breastfeeding if the baby is able to latch onto the breast if the breastfeeding or breast milk are not temporarily contraindicated. Maternal drug that is contraindicated with breastfeeding, like herpes lesion on the breast or cracked nipples when the mother is hepatitis C positive. Lactation aid, the breast milk will deliver a faster flow of milk which may reward and encourage the baby continue breastfeeding when the breast milk supply is low or when the baby has difficulty sustaining suction. Like a flow that is too fast can overwhelm and discourage a baby. The lactation aid at the breast may help to train and stimulate the baby's nutritive suckling reflex to improve oral coordination. It also helps to increase maternal confidence and promote maternal-infant bonding since the baby is on breast while receiving the supplement. The next one is finger feeding. Like finger feeding is a temporary feeding method when the baby is unable to latch or it's necessary to discontinue breastfeeding temporarily. A feeding tube is attached to one of the caregiver's fingers and is connected to a supply of EBM or ABM to provide supplementation to the baby. Finger feeding can facilitate proper use of oral muscle, promoting coordination of suck, swallow breathing, and to help the baby develop effective rooting, latching, and sucking patterns. So, the baby feeding finger equipment, baby bottle, artificial nipper for the bottle, 36-inch or 5 French feeding tube, scissor, tape, small syringe for cleaning the feeding tube after each feeding, and supplement fluid, EBM or ABM if breast milk unavailable or not appropriate.